So Philly, you know how we've been doing these health trials out at Mullaja and out at Budaga community? One of the things that kind of you and I talked about in the early days before we had the technology companies come over was to actually sit with community and be invited on community, and then get the companies to kind of talk about their technology. And then from there, once the community understood it, to then invite them to say, yes, we want to trial this technology on our community, and then work with the companies to help design the trials. Why do you think that was important for your community?
It was important for our people to know what we were about, and for them to have their say in what they wanted. Because people sometimes don't listen to the people of the country. They just come in and do whatever they want and then leave. And nothing gets handed back to the people. Yeah, so my people were so happy about it all, about how it all ran, what the outcomes were. And they were shocked with some of the outcomes. So, yeah.
Sometimes the people in the city, they don't realise that people in your community, they didn't have access to internet. Sometimes they couldn't even make a phone call from your community. And every time when the wet comes, the whole community actually gets cut off. So accessibility, like, be able to get access to the internet and things like that, having kind of like the internet access that was provided as part of the trial, has that been something that's been important to the community?
Yes, it's been very important, because it's hard to ring out, especially in emergency, when there's no internet or no connections to the outside world. So it's very hard for them, without having any access to anything.
A lot of people don't understand that on community, because of rheumatic fever, that a lot of the people sometimes can have heart problems because of diabetes. It affects people's eyes and health and other things like that. We trialled the heart monitoring, so we can test everyone's hearts, and then having the eyes and being able to check people's eyes and make sure from glaucoma and cataracts and things like that, try and stop blindness and impact on that, and also to try and stop strokes. And then even testing the kids, we found out one of the kids was almost, was under the scales, is blind basically, but hadn't really been tested properly. And then some of the kids' hearing has been affected. Do you think having access to technology where you don't have to leave community and you can just stay in your community and get your heart monitored, and then get a cardiologist in Perth to check that, to get your eyes monitored without even leaving community, why do you think that's important for community?
It's very important, because a lot of our people don't have access to vehicles, so it's hard for them to come into the main hospitals to see a doctor. And then coming in, you have to sit for hours waiting to even be seen. So a lot of our people just go there and walk out after an hour or so. So having those technology out there was really good. And to find one of our family members going blind is very disruptive and disturbing. When all these health professionals said they're going out there, and to us it seemed that they didn't. Otherwise they would have found the problem ages ago. So it's good. And I'm glad for Esther, Jack and Nicole and Rukshan and Yogi. Thanks to you all for having all these technology available for our people to use, and to fish, Mark, for you coordinating all this stuff, and for all your help with our people, especially since all the flood. And a lot of them hardly had access to any medical service. So.
One of the things that I thought was really important that we kind of emphasised, it wasn't just about, the physical health. you know, we were able to integrate like the teddy bear project and gives the children teddy bears so that they knew they were loved by the broader community. We're able to, through the Books for All program, donate books to the kids. And Scott, who's a Gooniyandi fella, was able to read a book in their language. And then we're also able to go out and get a killer and, you know, teach some of our mob, some of the white fellas that wouldn't bring up how to skin a cow, and then, you know, all the old people showed them, you know, the bush tucker skills and stuff like that. Do you think it's really important that health is not just about physical health, it's about the whole person? And in doing the trials the way that we did, why do you think that was important, that we kind of looked at the whole community and the whole person?
It was very important because the health professional and everybody got to see how the people lived, how they survive, how they, well, not hunt for their food, but how they gather food.
Yep.
Even though we went the professional way.
Yeah, that's right.
Not this $1,000 fine thing. But it was really good. And I think the people really appreciated it for you coming, sitting amongst them, listening to them, hearing what they had to say, and doing what they said.
Yeah.